So good afternoon. I'm Dr. Michael Caldwell, the Director of Public Health for Nashville-Davidson County. Thank you for joining us at the educational webinar today, focused primarily on religious organizations and religious institutions who provide religious services. We are now entering an important time period. I'd like to thank Mayor Cooper and in the Mayor's office, Mary Falls, as well as the other people who are on this webinar today for putting this together to communicate with you at this time when we are moving from the phase we have been in, which is complete social distancing, to now taking the baby steps of just phase one reopening. We'd like to talk to you about what that means. Let me pause for a moment to reflect and tell you how grateful we are to you and all of you for your leadership during this very difficult time. You've all been doing a fabulous job protecting your congregants, those who most fall into the most vulnerable categories, the elderly, those who are infirm. This is your mission, and it is our mission together to care for those with you. We are grateful that you have been putting your services on in a socially distant way. You have been doing a lot online, and you've been finding creative ways to reach out with your congregants so that even though they need to be physically distant, they are not socially distant. We are socially together, and we need to celebrate together, and we need to continue to work to protect each other. Moving forward, we look forward to having a continued education, communication, as well as an evolution of what you're doing. We want you to share and have best practices. But social distancing is still critically important, as well as wearing face masks. Today, we're going to be joined by the chair of the Board of Health, as well as the chair of the Coronavirus Task Force, Dr. Alex Jahangir. He'll be reviewing some of the nuts and bolts of operating in the age of coronavirus as we evolve from the phase we're in into phase one. Next, our Director of Environmental Health, Mr. Hugh Atkins, is going to talk about what you might be able to do to make your worship space more safe. And then we are grateful to have some peer-to-peer dialogue with Rabbi Rice and Reverend Dexter Brewer. So thank you for also being here. Mary Falls will then have a question and answer period, and then I'll come back to provide some concluding remarks. We ask you now to start asking your questions right away through the chat box feature so that we will have the opportunity to start answering those questions. So please go ahead and start asking your questions right away. So thank you. It's my pleasure to introduce Dr. Alex Jahangir.
Thank you all so much for being a part of this webinar. Thank you for, more importantly, actually, for everything you've done in the community. These past 2 months have been really challenging for everyone, myself included, and leaning on one's faith and one's community is so critical for us all. And it's made that much harder given the challenges of being together at this time. And so this is a great step in moving forward in that. And I just kind of wanted to share with you, as you may have seen this morning, Mayor Cooper has announced that we're going to roll into phase one of the city's plan effective Monday. And phase one really, the big difference is where we are today on phase one is that dine-in restaurants as well as retail will be open at half capacity. In addition to being open at half capacity, we're going to have expectations of, for example, tables being 6 feet apart from each other, no live music, no arcades, no entertainment, trying to minimize lingering that may happen. It also, I think it's also important to recognize that unless there's a vaccine, this virus will be with us. And because of that, people are, it's important, if you would, that you help us deliver that message to your congregants. I think what is critical is as we start opening places, people may get complacent, people may get comfortable, but but I ask is that if you could help us deliver the message. And so here's the thing. 14 days now, we will see what happens. So beginning Monday, 14 days. We'll look at metrics, including number of cases, hospital capacity, what we call the doubling time, so how quickly this virus is spreading in the community. We're looking at metrics such as public health capacity. Dr. Caldwell has led a great team of individuals to build a team to really quickly identify where cases are happening and try to isolate them so it doesn't spread out in the community. We're building testing capacity. As you all know, here in Nashville, we have testing 5 days a week, and hopefully with a mobile unit we'll put out there maybe 6 days a week. I encourage you to send people who may be worried about this to their testing facilities. But I need your help. I need your help as leaders in the community to let your parishioners know this virus is not done. Just because we're opening up doesn't mean we're done. In fact, I need everyone to be more vigilant. I need you, police, to lead by example. Wear masks. Try to, if you're willing to hold your services from afar still, do that as much as possible. If you have services, perhaps you, instead of half capacity, you may consider doing one person for every 200 square feet. Because again, we have such great, really big churches and small churches, so it's not a one-size-fits-all solution that can't really work for our city. But at the end of the day, know that you have a partner in this office, and we're here to help in any way in which we can. Assuming that our metrics all look good after 2 weeks from Monday, we'll move on to phase 2, which will then open up more things. And then 2 weeks after that, more things. And then finally, we'll be at phase 4, in which we'll be back to somewhat semblance of normalcy. But never does that allow for people over 65, especially, and people with medical comorbidities, to really let down the guard. And those are a lot of the people who rely on you for your leadership. And so I put that out there as a reminder. I'm grateful for everything you're doing. I look forward to the question and answer, and I'm going to turn over to Mr. Atkins. Thank you.
All right, good afternoon, and I'm glad to be here to talk about the phasing in and what you can do as a leader at your particular house of worship to prepare for your particular congregation. As Dr. Jahangir just said, all churches and church buildings are not the same. So what works in one may not work for another, but the important thing is that you, as church leaders, evaluate your particular congregation and decide what works best for you. So the faith leaders should evaluate their community and their congregation, because you don't know who might show up at your house of worship that maybe wasn't there in your regular congregation before all this began. And we count on everybody in the community counts on their church as a place of comfort and strength during these uncertain times, so it's important that we're prepared. But due to the potential high risk of widespread transmission of COVID-19 in gatherings such that are laid out like churches, church buildings, that's why Dr. Jahangir and others, Dr. Caldwell, have said if you have these measures in place to do electronic services, continue to offer that to help keep your crowds at a minimum. When you make that decision that it's time to start gathering in person again, that it's a different world than before COVID-19, and that's going to obviously change the face of how your meetings look. So evaluate that your congregants and determine emotionally and physically what their needs may be. You can demonstrate leadership by modeling behaviors like wearing the masks and keeping 6 feet distance between you and the congregants. I know it is just second nature in the church environment to hug and shake hands and greet, but you can greet from 6 feet and grin and be upbeat and still give a good welcome to your congregants without a hug or a handshake. Think about the percentage of your population that's vulnerable. One congregation may be younger and less vulnerable, and then some of these church gatherings are primarily people over 65 who are more vulnerable. So that will affect how you want to run your services. And certainly those folks that are above 65 or have underlying health conditions, if you can encourage them to take advantage of remote gatherings and to get those messages and lessons through radio or the internet, it would reduce the risk to the rest of the congregation as well. Children's activities are big in churches, we know that, and that's a great thing, but you might want to consider putting those off to a later time. Children present challenges with face masks. If they're under 2 years of age, they don't need to wear a face mask. So then also if you kind of stall on bringing those folks back in, that's nursery people that you might not need, and social distancing issue that might be eliminated by just asking them if they can wait a little bit to resume in-person worship services. And as Dr. Jahangir said, 50% capacity, but we're thinking about one person for every 200 square feet of floor space you have. Think about your worship space, your sanctuary, plus your classrooms and teaching space and other meeting spaces you have in your building, and be thinking about, use that yardstick of one person per 200 square feet of space. Certainly, if you have members that are symptomatic, have a fever, have been in close contact with someone who has tested positive for COVID-19, or traveled internationally or to a COVID-19 hotspot within the country, you need to, in the past 2 weeks, if they've done that travel, you need to ask them if they can wait to return to church until that period of time that makes it safer for them to come back, not only for them, but for the rest of the congregation. And if somebody has tested positive for COVID-19, make sure they're following the CDC guidelines. Talk to your local health department if you need to, and talk about methods for tracing those people, and also what methods of cleaning you need to shut down for. And a church building is different than, say, a retail establishment where people are in every day. Most church buildings, they may have some office staff there every day, but certainly the congregations are not there every day. So if you find out somebody was there on a Sunday, then you can certainly do a deep cleaning between then and Wednesday evening or the next Sunday before the congregation's going to return. Keep up to date on safety protocols, because recommendations on COVID-19 are constantly being changed and updated, and the CDC website is a good resource for those updates. Again, back to the leadership, communicate with your church families. Let them know the steps you're taking to keep the building safe and clean, and keep them safe, and keep you and the church volunteers and staff safe. And all the relevant ministries you may be operating, you want to make sure that they are done safely. Communication is great. Put things on your church website. Broadcast those in your messages when you're doing them electronically. And if you can, treat it just like we are asking restaurants and retail businesses. Screen your staff and your volunteers. Ask them questions. Have you been in close contact with somebody with COVID-19? Are you experiencing a cough, shortness of breath, or sore throat? Have you had fever in the last 48 hours? Or have you had a new loss of smell or taste? And have you vomited or experienced diarrhea in the last 24 hours? So certainly if they're answering yes to those questions, or if you take a temperature check on the volunteers and the staff, and they are over 100.4 degrees Fahrenheit, you need to direct those volunteers to stay away and leave the building immediately and seek medical care that's appropriate, that may even include a test for COVID-19, and then follow the CDC guidelines for when they would be allowed to come back to your congregation. Make sure, though, that you are maintaining a patient confidentiality with your congregants, just like we would ask any other business to do. You should plan for the event of a positive COVID-19 congregant or staff member, so be ready when that happens. So you're able to act, and as much of these policies as you can write down and get out to your congregation to let them know what you're doing. But the more of this you write down, the more visual you make it, the signs that you can put up, the people you have around the congregation directing people in the appropriate entrance or exit, or have somebody stand and hold the door open so we don't have several touches of that handle every time people are coming and going. Stay 6 feet away. That's the social distancing guideline that we keep repeating. And the hugs and the handshakes, I mean, it's tough, and it's just going to be second nature, but you need to try to resist that temptation. Again, the cleaning and disinfecting practices need to follow CDC guidelines. Sanitize shared resources after each use, and high traffic and high touch areas like restrooms, doorknobs, counters, microphones. Try not to be handing off the same microphone to people and cross-contaminating that. Soap and water are still necessary in your restrooms. You may have sanitizing stations all over the place, but let's keep good soap, water, hot and cold running water at the facilities to make sure people can wash their hands. Flyers are good to have out for your congregation to let them know what you're doing and what they can do. And you will have a diverse group likely in your congregation. So many of them will be exposed to sick people, and they need to keep that in mind, that they need to protect the safety of their fellow worshipers. You could consider returning to worship services in phases. Start at, we're saying 1 per 200 feet, or we're giving guidance of 50% capacity in retail, but as Dr. Jahangir said, you may want to start smaller than that because of the nature of your congregation. And communicate, again, the more communication you can give out, maybe the more problems you can prevent on the front line. And offer that stuff online. Bible study classes, you could have multiple classes on multiple nights rather than just the traditional Wednesday night Bible study, or multiple services on Sunday if you have the capacity to do that. Multiple in-person services would certainly reduce your crowd. So that's something to think about along with the electronic services. Rely on, again, entrances and exits. If they can come in and leave from different exits, that cuts down on the problem of people congregating. Your pews and benches, block those off, mark them where families certainly can sit together. They ride together to the church. They're in the same home. We know they want to sit on the same pew together, and that's great. But make sure you got 6 feet between them and the next family that is worshiping. Modify some of your distribution protocols, like your communion, and avoid passing plates and cups that people are going to be touching. Hymnals is another thing people touch and handle. Consider maybe taking up the hymnals for a while and projecting your hymns up on a screen. Many churches already do this. Avoid, I said, sharing microphones. That's down here good again. You might want to think about temporarily replacing the choir with soloists. or small ensembles that can spread out with 6 feet between them as they are delivering their songs. Post signs, again, signs are a great thing to remind people, not only with social distancing, but to increase the frequency of their hand washing. Make sure you have some cloth face masks for those that come that might not have one, or left it in the car, or forgot it, or it malfunctioned like mine seems to do a lot. So you don't want them wearing N95 masks. We're still reserving those for the medical providers. But certainly if you've got one at your disposal that you can give them, that will eliminate a lot of problems. They should be used by that one person only, and if you collect those as they leave, they need to be laundered, and you don't need to give them to anybody else until that happens. So no sharing of cloth face masks, or any face masks for that matter. Another popular thing in churches is coffee stations, and you need to eliminate that for right now, especially where they're coming up and serving themselves and fixing their own coffee, and dinner on the grounds, another thing that probably need to wait on for a while. And then one last plug, it counts for churches too. Metro Water Services has reminded us if your building has been vacant for a while, you need to flush out all your water systems through every utility you have there to make sure the water that's in the building is properly sanitized. All right? Oh, yes. Communion, I mentioned. Collection plates is another thing. They go down the aisle, and cross-contamination, it would be good to eliminate the collection plate, encourage online giving, or direct withdrawal, all kinds of electronic type of money collection you can use there at your church just like you would in any other business. So yeah, anything like that that people are commonly touching and just sending down the aisle with everybody's imprint on it needs to be eliminated. And again, I'll be around during the question and answer. I'm sure there are things that I forgot that other people will think of, but again, we appreciate everything that the faith-based community has done to help us flatten the curve in this pandemic. Thank you. And our next speaker, let's see, I got it here, Mary, somewhere. Oh, Rabbi Rice is the next speaker, and she's coming to us electronically, I think. So.
Hi, everyone. Can you see me? Great. For having me with you this afternoon. It's a pleasure to be here. So I am one of 2 rabbis at Congregation Micah. Our synagogue building is in Davidson County. The cemetery out back is in Williamson County, so that should give you a sense of where we're located. We're in the Davidson County part of Brentwood, which is not a big sliver. Like many of you, we have been out of the building and conducting all of our programs and services virtually since about March 13th. And everything that we've heard so far on this call are the guidelines that we are following and plan to continue to follow as a congregation. We have about 500 families who are affiliated with Congregation Micah. So at our Holy Day services, which we look towards in September this year, we can anticipate anywhere up to about 1,000 folks in attendance for one of those services. And then weekly, depending on the program, and I know this is like many of you, we can expect anywhere from the smallest class of, say, 15 people up to 250 in our religious school on a Sunday morning. Can you all still hear me? I just want to make sure I'm coming through. Okay, great. Thank you, Dexter, for letting me know. But we met recently a group of our lay leaders and staff to talk about what reopening at Congregation Micah might look like. And bottom line is that while we feel pulled, as all of you do, by this desire to be in person, and really hearing the rabbis whispering in our ears, do not separate yourself from the community, we also know that the health and safety of our members and our staff, and really the entire city of Nashville, is more important than any in-person gathering or experience we might have in this temporary time. Really focused on the word temporary because while it feels like we've been doing this social distancing and sheltering in place for quite some time, it's really been a blip in many of our lifetimes and likely in the history of our congregations. So we're kind of going with the idea that we don't plan to be first to the party. And we're going to take advantage of the fact that the summer is, for us, and I imagine for many of you, a slower time for programming and attendance as is. Really capitalize on that and not plan to be in person through the rest of the summer. May sound conservative to you, but until August 1st. Interestingly enough, we imagine that attendance at virtual services and programming through June and even in July, when normally we would really not have much going on at all, that will probably be stronger this year because people are home, as you know, and looking to connect and be connected, even when they can't do so in person. So whereas before we may not have programmed as robustly going into the summer months, that's something that we're looking to do virtually now, knowing that people are really needing that connection and wanting to feel linked to the spiritual community, in our case to Micah. But our sense is that our members are quite anxious about re-entering society and want to be spiritually and intellectually nourished, but not at the sake of their health and safety. So I saw a couple of interesting questions in the chat too that I thought I might just reference. That we talked a lot about, what would it look like to plan for the holy days coming up, and honestly, both our end of the year annual meeting and our holy days are we're planning for full virtual experiences. It may be that we can have some kind of in-person gathering, but as we discussed it, we thought, first of all, we're not in the business of monitoring people's temperatures and doing contact tracing and who would be allowed in and who wouldn't be. And we really saw, at least for Congregation Micah, we saw that we're either open or we're not. And so if that's the sort of black and white measurement by which we are gauging reopening, it means that we're going to really sit back and see what the metrics look like for much of Middle Tennessee before we take that plunge. Again, just wanting to maintain the safety of our members and our staff. When it comes to our choir, we can't imagine really in a safe, socially distanced way having people standing next to each other and singing, especially what's involved with regards to singing, not wearing a mask and all sorts of fluid that we know can leave the facial area during that kind of activity. So that's just one example of one of the reasons why it seems appropriate to continue to socially distance and call this what it likely will be, which is, God willing, an anomaly year, where we just have to do things differently for the sake of saving lives. So I'll end there. Happy to answer any other questions, but I'd like to pass to my colleague, Dexter Brewer.
Great. Can you hear me?
Yes.
Yes. I was thinking, how does the worship, the purpose of them really is to give us the tools that we need to navigate life, the ups and downs of life, the journey that life is, and this has been difficult. I think we've learned a lot too, and we've been able to put into practice, Christ the King anyway. Many of the things that I preach, many of the things that come from scriptures, and ordinarily during Lent, which was 2 weeks ago, we would kind of manufacture this desert experience, by giving up things and trying to create an environment where there's silence and kind of a longing for God. This year has been different. We didn't have to manufacture the desert experience at all, because the experience came to us in the face of the coronavirus. And so it was a very unusual Lent, but I think it was a very fruitful Lent in many ways. And those with whom I've spoken have said that for them it was a very, very fruitful time. Difficult time, because we're separated, and everyone wants to be together. But there has been some grace in this. I think even as we look forward to returning to life as normal, whenever that is, later this summer, early in the fall, I think it's important to recognize the graces that may have come from our communities, realizing what their greatest values are. What we've done over the last few weeks to keep people connected, we will continue to do the online programs that we have. I don't do live streaming masses because there's so many available, including the mass that the bishop does today. But we do have online discussions. We continue our adult education programs online. We place as many things on our website as we can, places where our community of 2,000 families can go for resources of every sort. And those resources extend not just to what's available in Nashville, but also to Notre Dame, to the monasteries around that do live streaming of prayer services and masses, even to the Holy Fathers, of course, his live streaming of masses and those things. We will continue to do that, because even when we decide to slowly bring the community together again, and I think we will do that probably toward the end of May, the beginning of June. Even when we do that, there are, as I think has been mentioned, there are still many others who need to stay away from the gathered community, but for their sake, for their health, and for the sake of those around them. And so we will continue to make available to them all the things that we've done, probably throughout the fall. When we do come together, we're blessed to have a field here where on occasion in the falls anyway, we will celebrate masses for families of the parish. We will try initially to use that outdoor space for the celebration of Mass. I don't imagine there will be any more than 50 to 100 people there. I think the crowds will regulate themselves initially, because I've spoken to many people, and most, quite frankly, aren't comfortable at the beginning to gather with large groups, or even with groups of 50 or 100, as soon as we are able to do that. So the field, which many hundreds of square feet, will provide us, I think, with the necessary distancing that will be good for us. We look forward to starting. We will do all the things that have been recommended, that were recommended by those who spoke before me, and continue to do the online things, which everyone in our community has found very helpful. And quite frankly, I have as well. Yeah, so, with that, that's it on.
Thank you, Father Brewer. Dr. Caldwell, first question for you, please. Per Executive Order 30, the Governor's Office says that municipalities can't place meeting restrictions on houses of worship. If a church plans to resume in-person services in the near future, are we required to communicate that information to someone at the city?
No, you're not required to communicate that to the city. We are here to help provide guidance to you and hope that you can do your best to maximize all of the guidance with social distancing as possible, as well as face masks and other items that we discussed today.
And could you also just address the obligations regarding face masks in general in churches and elsewhere?
Yeah, well, face masks, we really want everyone to get into the habit of having their own face mask at all times. It should be used unless you have a medical reason when you cannot use it. It should not be used in people under the age of 2. It's important because there are going to be more and more places where they will not let you in without the face mask. We'd like to encourage you to be one of those places where you welcome guests and ask them, encourage them to wear face masks. If they don't have one, that you might have a supply of clean, laundered fabric face masks or these surgical type masks to offer to them and to help us with this social normalization of wearing the masks. Because remember, the mask is a sign of respect that my breath, even though I have no symptoms, I might be carrying the COVID virus. So by me wearing the mask, I have respect for you. I show you respect because wearing the mask most likely is going to reduce me giving the COVID virus to anyone else. So please keep that in mind.
So if children under 2 can't wear face masks, should they be attending worship services?
I think that will have to evolve on a case-by-case basis. Certainly if the child is not well or anyone is not well, I don't think that they should be permitted to worship services or out at all in the public.
What is the phase-in of the size of groups for worship? I think the question is getting at, as phase 2 and 3 progress, what size congregations are going to be permitted?
Yeah. That information will be available online, so I don't have the specifics right now.
Okay, thank you. And next question is going to be for Hugh. Hugh Atkins from the Health Department in charge of the environmental section. The question is regarding different spaces within one place of worship. So if you have classrooms and other places that you could have a meeting, how does the 10-person cap work? Is it 10 for the entire facility, or is it 10 per room, or how do they comply with those requirements?
Well, I think to start back with the recommendation of the 1 per 200 square feet of space that you have in your church building, and then consider your individual classrooms and other gathering centers. So once that total that you arrive at, that is going to be at your worship service, if some of them are meeting in classrooms, then that's going to depend on the size of that individual classroom, how you can split them up and have social distancing within that room. Some rooms may not be able to hold 10 people and keep them 6 feet apart. And again, we're talking about groups. So, a family or a couples class, obviously the couples can sit together, but we need 6 feet between them and another couple. So think about your overall number that you can have in your building based on the 1 per 200 square feet of space in your building. And then you're going to have to think about individual social distancing as you disperse them within the building, whatever those spaces might be.
Thank you. You mentioned earlier about removing religious texts, hymnals, shared items from the worship space so that multiple people aren't touching them at one time. And a question related to that is disinfection of the seating areas. Should that be done between services as well as at the end of the day?
Right. That's the way it would be recommended between services as everybody's up and out. All the contact surfaces and pews and seating areas need to be disinfected. And then when everybody's gone for the day, do the cleaning of the entire facility.
Right. Could you address signage that should be outside places of worship?
And, I think they need signs that recommend things like the face masks, and if you're ill, you should not attend. I don't know, Dr. Caldwell, the Order 4 that you issued on the signs, would that apply to a church building as well? There's a Order 4 that Dr. Caldwell, as the medical director, issued that requires a sign that recommends that people wear masks. So that sign is available on Metro's COVID-19 website, and you can get that and put it up, and it needs to be at every entrance to your facility.
Do we need to worry about ventilation during or between worship services, even with social distancing in effect? I've heard that the aerosolized form of the virus can stay in the air for 3 or more hours.
I'm not sure about that. That may be an answer for Dr. Caldwell on the behavior of the virus. I don't think, just as he's coming up, I don't think in general on ventilation, as far as it traveling through the ventilation system, that would be a problem. It could maybe blow it across an area, but I don't think it would get circulated by the ventilation system. But as far as how long it would survive, Dr. Caldwell would be a better resource than
I think this all goes to us learning more about the virus and mitigating and reducing risk. Right now, wearing the face mask is going to be very, very helpful. I think that there is still some minimal risk of the virus going around, and if it is, it's very, very tiny. And even if it's going around, we're not sure it can actually infect somebody. Remember, it's that dose of the virus that goes into you that is so important. So being close to someone within 6 feet for more than 10 minutes, somebody without wearing a mask, that's going to give you the highest risk. So as you go out to these other areas of wanting to eliminate risk completely, I don't think we'll ever be able to eliminate risk completely, but we want to eliminate it as much as possible. So the guidelines that we have are the ones you should focus on, and if we learn more about HVA systems, we'll let you know, but don't be distracted by that right now. Keep the social distancing. Good air circulation is important, and try to encourage everyone to wear the masks, and try not to encourage any of those frequently touched surfaces as much as you can.
Dr. Caldwell, several questions regarding the discrepancy between the current recommendations we're putting forth and the preceding recommendations that were in the roadmap. So regarding churches having a very, very low capacity and then ramping up over time, and then how that conflicts with the governor's statement on this. So if you could just address the difference between those and which rules apply.
Yes, well, there's going to be an order number 5 coming out, public health order, which is going to be out within the 24 hours. That is going to reflect the roadmap phase 1. And religious institutions are going to be specifically weaved into what the state requirements are. So we're not going to have separate ones. So whatever the governor's order is the one that is going to have the greatest effect. Once again, we want to encourage everyone, if you can, continue to have your services in the format you are, socially distanced, online. The longer you can continue that, especially for the most vulnerable, the better we'll be. This is just an opportunity for us to take that first very slow step to trying to live in this new COVID world.
Dr. Caldwell, several more questions regarding children. So questions regarding child care during services, classroom instruction for children, and vacation Bible school and other camp activities that are offered by religious communities. Any guidance on those?
Well, there are guidance for daycare and child care facilities, which I would ask you to go look for those resources online, specifically from the CDC, on what best practices are for daycare centers. Mr. Atkins and I have gone out to a few different daycare facilities to provide a walkthrough to help come up with some best practices. If it's possible to have one entrance or one exit to reduce people being in close contact. If you are able to very much limit the number of children to a particular staff person, that would be really important. I think in your planning, you have to plan somebody in your congregation that you've contacted will test positive for COVID. You need to know when that happens, what you're going to do. Think that through now so that when it happens, you'll have a plan. It will also reduce your anxiety and reduce your uncertainty about what to do when it happens. Because I assure you, it will happen. And you will then be in a better position if you've planned this out to know, okay, this person tested positive. Now I'm going to take steps back. Where were they? Who were they sitting with? So it's incumbent on the person as well as the religious community to have a way to do that contact tracing to help our epidemiological staff when we say, oh, so-and-so is tested positive, who are they around? So we can then protect others and then get those others that were around them, even though they are without symptoms, to prioritize them for being tested.
Thank you. Another question for you, Dr. Caldwell. The plan says that, quote, all essential businesses and non-essential businesses should begin preparations for later phases and should be prepared to certify to the local health department that they have written plans. Do churches need to have this plan to open?
You're not required to have a written plan. It's great to have a written plan because it gets your leadership together, your employees, members of your community to sit down and think about what should be in the plan. What should it look like? Look for a blueprint. Try to chart out where you're going to have people sit or stand and where they're not, entrances and exits. The more that you can think this through, have a written plan, that's a document you can share, get feedback on, and it's going to be a living document, something that you're going to continually improve. And then when you do have somebody that's tested COVID positive, you'll be part of that plan. You'll know how to improve it. So it's not required. We'd like you to have it, and we will do our best to be available to give you guidance on a case-by-case basis, but we're going to direct all of you to some of that general guidance. And as well, we hope that there'll be opportunities for you to share some of these plans with each other because you can learn best from similar environments.
As someone who's recovered from COVID-19, do I need to wear a mask? I see no literature one way or the other. I do know that I need to be considerate of the health of others as well as the perception that I care about them. Any advice?
Well, it sounds like you want to wear a mask, and certainly, yes, I would say that we don't know once you have recovered from COVID whether you can catch it again. We believe that the viral shedding will only last about 2 weeks or so, but who's to say that maybe in another 3 months you might have it again. But the person that you're around, they're not going to know that you had COVID or responded, so they're going to see this as a sign of respect. So if you can wear the mask and think of it as a sign of respect, whether or not you've had the COVID, we'd really encourage you to do it. Thank you.
Several questions. I'm going to sort of read them consecutively.
I may try to one. I don't know if I'll remember them all, but we'll try. Okay.
Well, it's the same theme.
They're all the same.
It's the same theme.
All right.
How are churches expected to regulate who can and cannot attend? Why not just wait until all who wish to attend are allowed to attend? And our congregation has a significant sector of older adult senior population. We're considering not returning at all to in-person services until July. Would you agree that this would be a wise approach?
Absolutely. Having this phase 1 opportunity is to allow you to have discretion on what you think is best for your congregation. As your director of public health, certainly anybody over the age of 65, chronic medical conditions, we really believe they are much safer at home overall. And the more that you can do to keep them safe, keep them at home, is in keeping in that spirit. So please, if you are able to continue operating without opening up, bringing people together, that's the best course of action right now. You might say, well, let's wait till we can bring everybody back. That day will probably be when we have a vaccine. That day will come, and we will all celebrate it. But right now, we want to make sure that we can celebrate as a family and make sure all of the members of our family are with us and not sick and not put at risk, feel safe, and certainly not to be with us through this journey. We want everyone to make it to that side across the river, these uncharted waters. That land is there, and that land is a vaccine.
Next question is for Rabbi Brewer and, Rabbi Rice and Father Brewer. Will you be wearing masks while you are presiding?
Yes, I will. And everyone who's in any way serves at the liturgy, as well as everyone in the congregation, and we're requesting that members of the congregation find a mask that they really like, or one that's colorful, fun, and that they make it a habit of wearing it not only certain
Father Brewer,
I don't have
we're having a little
to add to Pastor Father Brewer. I imagine when we do reopen that we will also wear masks as well as required of everyone who's in attendance, unless for some reason, God willing, that's changed in our Middle Tennessee environment, that we are no longer required to because of some development. But until then.
Thank you, Rabbi Rice. Hugh, these are for you. Quite a few questions. People are still confused about the 200 square foot rule, the 6 feet apart recommendations, the 50 versus 100 congregants. If you could make that as crystal clear as possible, that would be helpful.
Okay. The one per 200 square feet is, again, a yardstick to use for how many people you should allow into the in-person service. So then it becomes you have to social distance whatever number you have. So again, that number is going to fluctuate or vary as depending on the size of your building. So, but no matter the size of your building, by square footage, that you come up with the number of people that can come in, then once you get them there, you have to have a provision for how you can socially distance them within that 200 square feet per. And, that's a challenge that right off the bat, it's going to be, 4 people together here with 6 feet between them may take up more space than you're thinking about one every 6 feet. You just don't know. So you're just going to have to try to get a plan for how to manage that. I don't know what I guess 50% capacity is what they meant, or 100%. I don't know those numbers of 50 people or 50% capacity. I'm not sure. I think, and there is some confusion because, like a previous question, I think there were more conservative type rollouts in phases before it was decided that the state guidelines were going to prevail. So the state guidelines go with the 50% capacity. The 1 per 200 square feet is a yardstick to achieve that, I think, and still have social distancing. The 50% capacity is a max, but you may not be able to have that if you can't social distance, and maybe that's the best way to state it.
Another one for you, Hugh. Would there be a benefit to having a service dedicated exclusively to people 65 and older and other vulnerable populations?
Well, I think possibly for a couple of reasons there would be. you might have those people that would reduce each crowd. You would have fewer of those people together. So that would be a smaller gathering, and those people wouldn't be in the gathering with the rest of the congregation. But as far as their vulnerability, that doesn't make them less vulnerable because they're all together. They're still over 65 years old. They still have underlying health conditions. So just because you've separated them from the rest of the people, what you're doing is maybe obviously they won't be vulnerable to being around those people, but they would still be vulnerable around each other. But just the reduction of the crowd would be a positive thing.
Another question for you, Hugh. Where do congregations obtain the masks that they're being told to encourage congregants to wear?
Well, lots of people are making masks and homemade masks and donating them, and there are resources for that. I think online, again, at some of these websites that we've mentioned, but a homemade mask, perhaps the congregation could enlist that as a ministry, making their own masks to make sure that they are covered with masks enough for their congregation. But you've seen different masks. Dr. Caldwell and I are wearing these today, but we have a slew of masks around. My sister gave me one with a penguin face on it. I've got a cloth mask that's plain, like the one that some of the people in here have. So they're not real high-tech items. They can be produced and made by virtually anybody who has minimal seamstress skills, I think. So maybe that would be something that a project that they could do to make sure but there are places to acquire those, yes.
A couple of questions for probably Rabbi Rice and Father Brewer regarding teen activities. Any suggestions on what type of teen activities would be appropriate? Any guidance on those?
I see Father Brewer, are you talking? I'll jump.
I was trying to get a clarification of a question. Did you say teen activity?
I think teen, yes.
Teen. Why don't you take it?
I probably will end up sounding like a broken record, but I'm going to come back to the fact that we're doing everything virtually because at this stage we just feel like it's still unsafe to bring people together. And I can't urge the conservative approach enough. I really feel as though God will wait for all of us to be together in person. And that it feels like a long time and it feels weird to be separated when we are all in the business of building community and bringing people closer to serve God through all our various channels and all our various ladders and paths. But whether it's a child in services or a teenager who we know, I'm living with 3 at home right now, really relies upon social connection for their own mental and spiritual growth, or it's somebody over 65. I just think there's so many elements to keeping people safe right now. It's not just about 6 feet apart. It's about the surfaces that every single person touches without even thinking about it. And we're willing to take the responsibility to make sure that those are constantly cleaned and sanitized. We're willing to take the responsibility that the next person won't get sick because of something we overlooked, because we were in a rush to bring people together of any age. I just have to urge people to be really careful and thoughtful. I'm dying to go out for dinner and hang out with friends as much as the next person, but I'm also able to wait. And I think patience is one of the lessons of this time for all of us.
And I would agree.
Thank you. Dr. Caldwell, last question is for you. The state of Tennessee is allowing churches, of course, to open by following CDC guidelines, and some will, in fact, open this Sunday. Is there a recommendation from Davidson County about opening this Sunday?
Well, The governor's order will take precedence right now, so you can follow that for the religious congregations. We very much want you to go as slow as you possibly can and know that COVID is still out there. There's still people at risk, and we want everyone to feel safe.
And Hugh has a clarification.
Oh,
Sorry.
okay, excuse
Thank
me.
Yes, another thing that I should have covered and another suggestion when we were talking about passing the collection plate, one of the good suggestions for avoiding that is to have a collection box or a collection basket maybe at the back. As people file out, they can just drop their offering in there and take care of that. A good yardstick too, I think, would be focus on having safe worship services and not so much on social gatherings. Churches are certainly a gathering spot for communities and families, and we like to get together and have common meals and parties, and those are great things, but let's ease back into focusing on the worship services and leave the social gatherings for later if we can. And then, speaking of social events that are associated with churches, we all think about weddings and funerals and baptisms and other religious ceremonies. You need to have a plan in place for how you can ease back into those types of ceremonies and still observe social distancing and CDC guidelines. And you might, on funerals, for instance, consult with the funeral director of the family member, because they are dealing with this as well. And you can read obituaries today and see where they will say, due to COVID-19, we're going to have a memorial service at a later date, or they're just going to have a graveside service where people can spread out, maybe with amplified speeches. So those are things to keep in mind as well. And those go across all faiths. And we were fortunate, I think, to have representatives from the Christian, Muslim, Hindu, Jewish faiths all on the webinar today. And these are common goals, and they're common concerns. We all want to have services and activities, but we all want to make sure they're safe. So I appreciate the opportunity to talk to everybody.
Dr. Caldwell?
Well, we've come to the conclusion of our first conversation regarding the religious congregations and the spiritual work that you do, both in physical locations and throughout the community. So thank you for participating. This webinar is recorded, and you will be able to share it with others. So there's a lot of good information here today, and I hope you will spread the word. Thank you to the mayor, Mayor Cooper, and Mary Falls in the mayor's office, as well as all of our technical support team who's been here to help us. Couldn't do it without them. And thank you for your time and participation. Thanks to Dr. Alex Jahanger, the chair of the Board of Health, as well as the chair of the Coronavirus Task Force, and Mr. Hugh Atkins, our Director of Environmental Health here at the Nashville-Davidson Department of Public Health. And thanks to Rabbi Rice from Congregation Micah for your thoughts, and as well as Reverend Dexter Brewer from Christ the King Catholic Church. We really appreciate your participation and your sharing of best practices. We look forward to continuing these conversations and look for other resources on the covid19.nashville.gov website. Have a great rest of your day. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.